Assalamu alaikum and welcome to our presentation. Today we are going to discuss diagnosis of the diabetes. Diabetes is diagnosed on the basis of three important investigations which includes HbA1c level, fasting plasma glucose level and oral glucose tolerance test. The population is divided into three groups. In a normal group, there is HbA1c level of about 5 while fasting plasma glucose level is 99 or below. While taking oral glucose tolerance test, the value after taking 75 gram of oral glucose, the plasma glucose level should be 139 or below. In a pre-diabetic group, which are more prone to have diabetes in future, HbA1c level is 5.7 to 6.4 and plasma fasting glucose level is 100 to 125 milligram percent. While on oral glucose tolerance test, the value should be 140 to 199 milligram percent. While in diabetic group, HbA1c level is 6.5 or above, while fasting plasma glucose level is 126 or above. Oral glucose tolerance test will show the value of 200 or above while having the 75 gram of oral glucose. Some words about type 1 and type 2 diabetes mellitus. Type 1 diabetes mellitus usually presents with polydipsia, polyuria and weight loss along with the random plasma glucose level of more than 200 milligram per deciliter and usually presents in the early age groups. Plasma glucose level of 126 milligram per deciliter after an overnight fast documented on more than one occasion is also found in the type 1 diabetes. Ketonemia, ketonuria or both may be present, while islets autoantibodies are frequently present in these patients which are having the type 1 diabetes mellitus and there is malproduction or there is no production of the insulin for the control of the blood glucose. Generally, these patient progresses from stage 1 to stage 2 and the stage 1 is autoantibodies but having normal glucose tolerance. While in the stage 2, these patients have autoantibodies with glucose intolerance and in stage 3 the disease is apparent and there are symptoms of the diabetes mellitus in these patients. While in type 2 diabetes mellitus, the patients are usually 40 years or above and having the same symptoms which includes polyuria, polydipsia, ketonuria, and weight loss. Common infections may be the initial manifestations as these patients present to their doctor with the common infections of the different parts of the bodies and on having investigations they are labeled as diabetics. Plasma glucose level of more than 1.6 milligram percent after an overnight fast on more than one occasion is also a diagnostic for the diabetes. 2 hours after 75 gram oral glucose, diagnostic values are more than 200 milligram percent, while HbA1c level of more than 6.5% is also included in the diagnostic criteria. As the type 2 diabetes is a part of metabolic syndrome, so there are some other diseases which are usually present along with the type 2 diabetes, which includes hypertension, dyslipidemia, and atherosclerosis, along with their symptoms. You can follow us on our social media and also on the web. Thank you very much.